How do GPs receive information from hospitals about discharged patients?
By letter. There's an initial discharge slip which is usually given to the patient as well. The patient has a copy of it, but it gets sent to the surgery, which gives the basic information, and then often a letter comes, particularly if something significant has happened.
Mm-hmm.
A letter comes later. It depends a little bit whether the person's been admitted for an acute problem, in which case you might just get a discharge slip saying this person had a urinary tract infection, it was treated, and that's that. But if they were admitted for a hip replacement, then the discharge slip would come indicating hip replacement, but it would be followed by a more formal discharge summary giving, the exact proper printed rather than handwritten summary of what had happened.
And then is this information stored as a hard copy or electronically? Or?
In my practice, we scan them in and then shred the hard copies.
Do you know whether some practices will just store those in a file?
Yeah, some of them will. There are fewer and fewer these days. Most of them are scanning them in.
And this tends to be just a written summary of what was undertaken in hospital?
Yes. That's the situation on the discharge. As I say, it depends a little bit on what happened over how formal it is. The sort of informal discharge slip, which is sometimes handwritten by a junior doctor, that might be all you get if something has happened that's fairly simple. But I know at Warwick Hospital, for instance, they do have a way of printing the information in a standard format on the discharge slip. So a junior doctor will fill in the details, and there'll be some free text which is printed, which is typewritten rather than handwritten. And then, as I say, if there's been an actual procedure, that has to be recorded, and that of course will need to be coded into the system of the surgery. So that usually is sent on in a more formal way with a letter, at some stage later, and it's that letter that we use for the coding usually. If somebody's had a hip replacement, we usually wait for the formal letter to come, and then we will code it into the system that's what's happened.
So, in a way, the practice and the hospital are almost running parallel systems.
Well, they are very parallel systems, yeah. They are very parallel systems. Surprisingly so after all this time.
And the information transferred between the two is generally paper-based.
Yeah, it is generally still, yeah.
How does information get from a GP to the hospital, to patients in the hospital?
Well, the referral system has changed a year or so ago to this choose and book system, and it's becoming much more electronic. So if I see a patient and I want to refer them to the hospital, I will actually register the referral during the consultation on the appropriate NHS website, generate a referral number for the patient, which the patient then takes away with them. I print it out for them, they take it away, and they then ring in using that reference number to book themselves in to whichever clinic it is in the place they've chosen. I then dictate a letter which gets typed up by the secretary, and the referral gets sent on. Now, I'm not certain, I have to say, whether we've got to the stage where that referral letter gets sent electronically, but I know that we quite frequently add attachments.
Yeah.
So I've got a feeling it's still paper-based, but we're at the point where that could easily be electronic.
What would happen, for example, if a patient was taken in at home and was taken straight to hospital? There wasn't the referral process from the GP. Would the hospital have all the relevant information from their GP accessible?
No.
No.
No, the hospital would have hospital-based information about the patient, which would include details of any previous admissions.
Yes.
They would also have access to blood tests and other investigation results that have been arranged by the GP, but they wouldn't have access directly to the patient's electronic record. There is an exception to this in that there was a system set up in South Warwickshire a few years ago, the Demonstrator Project, whereby a number of the practices in South Warwickshire agreed to have their data hosted on in a data warehouse and stored there and backed up every 24 hours or so. And the idea behind that was that the hospital, particularly casualty, would be able to access a certain amount of information with the patient's consent at the point of contact. That was the idea behind it. And the system was established, but I don't think it was used very much.
Was it deemed unnecessary, or was it overly complicated?
I'm not sure. I think you'd have to ask somebody in one of the casualty departments. I mean, I know there was some feedback that indicated that it was useful and it was used, but the whole system wasn't used to the extent that it was anticipated originally.
Have you had much experience working with the elderly in care homes, for example?
Well, I visit care homes quite frequently.
How does a GP's role adapt to suit the environment when visiting a care home? I imagine the process will be different due to the concentration of patients which need to be seen in a certain time.
Well, usually we get asked to go in, or we arrange to review a patient. But when we visit a care home, we're usually just visiting one or two or perhaps three patients. We don't go and see a whole block of patients. That's not as a routine thing. But there are times when the home might, if they know we're coming to see somebody, and they'll ask for a couple of other people to be seen as well. But we will then take the records of those, sort of print out of the summary of the records of the people we need to see. And so we see them in a similar way to seeing somebody at home who isn't in a care home, except that you've got the backup of the caring staff or the nursing staff in the home. So that's different from that point of view, and you've got their records as well.
Yeah.
So if you go and see somebody and you want to know how their swallowing has been over the last week, there'll be a record of that, which there wouldn't be for housebound patients at home.